Hey everybody, good morning or afternoon, depending on where you're joining us from. My name is Matt, and I want to first off thank you for registering for our webinar today. We know your time is very valuable, and really appreciate you choosing to spend this hour with us today. So first off, a couple notes. We will be sending out a recording of the webinar as well as a copy of the slides. This webinar is currently pending approval from the Compliance Certification Board. So your CCB certificate, CEU certificate will not be going out today, but I will follow up with everyone directly once we hear back on the status of that approval. So let's get going. Today's presenters, if this is your first webinar, I will introduce Mike Rosen, our co-founder with plenty of experience in the background checking industry, and he is a lawyer and has plenty of compliance knowledge in the industry, and is a trusted leader here at Provider Trust. So we are happy to have him presenting. Donna Thiel, our Chief Compliance Officer, with plenty of experience in the long-term care industry for a top company there, and we are so happy to have her. She brings a lot of value to our monthly webinars. And finally, Dave Servadidio, our Director of Marketing. He's just kind of a industry guru and brings a lot of knowledge in a lot of different places. And he previously worked with health plans, and he also helps partner with some of our HR partners here at Provider Trust. So this is our trio, and it's just a great team to have on this webinar. So you guys, it's going to be great. A little bit about us. We are made with love in Nashville, Tennessee. We've called Nashville home for 10 years. We partner with a lot of organizations here in Tennessee and across the nation, and we are we love it here and are happy to be able to share these webinars with people from all states. So thanks for being here again. We recently rebranded as a company, and something that we truly believe in is that a smarter healthcare makes a safer healthcare, and we back that up by working diligently to focus on monitoring healthcare populations across the industry to identify compliance and credentialing issues before they impact patients. So we really just like to, besides partnering with HR and compliance folks across the country to make their jobs easier, we really focus on building products that are easy and simple and just make life and work much easier and make you sleep better. So that's a little bit about us. Our webinars, we do these monthly, and we're so happy to share them with you. One of our company values is help others grow and succeed. So we see the privilege in being able to partner with you guys and provide this valuable information. And again, just really value you choosing to spend your time with us to learn and grow with us as the industry progresses. So our webinars coming up, we have the next two of our HR series. The first one being how top HR teams manage license and credential verification. And then in September, we will have our final webinar of the series, how top HR teams focus on culture by developing and empowering people. And we've got some great guests for those. So we hope to see you on the next two webinars of the series. Another note is that we are currently seeking HRIC accreditation to better partner with our HR folks on the line and provide those valuable credits that I know you guys need. So more to come on that. And a little bit about today's agenda. We'll start off by kind of outlining the current state of healthcare hiring. Then we'll move into smarter healthcare recruiting, followed by predictive data and monitoring, and finally action planning with your team. So how you can really implement this at your organization and make it better. So with that, we will kick off with the current state of healthcare hiring.
Awesome, thanks, Matt. Before we get into it, a couple quick things that I wanted to remind everybody of. a quick reminder for those that have been to a webinar previously with us. And for those that might be new, we do record all of these presentations, and then we do send out the slides. So at the end of the session, sometime this afternoon, you'll be getting the actual slides from the presentation today, as well as a recording of the session too, that you can continue to use in internal training. Last thing too is we certainly encourage some questions as we go. So we'd love for this to not be just us talking at you, but please submit some questions at any time via the, you'll see it in your questions panel through GoToWebinar. Just type in a question, we'll be able to see it. We'll respond to as many as we can, either during the presentation, or we'll try to get as best we can, we'll get to all of them at the end. We always answer every question, so if we don't get to it on the actual slides or during the hour that we have, we will follow up with you directly this afternoon. So with that, we will get into it. So the current state of healthcare hiring. We'll take you through the problems, but just a couple of why we're starting here. We understand that in our experience in dealing with talent is we firmly believe that getting the best talent in your organization is critical to delivering the best care for your patients. So in part of the three-part series that we're doing over the next 3 months, we wanted to spend some intentional time on how to actually use data, use process, and use predictive analytics to combat the problems that you see on the screen. So this is not news to anybody. Healthcare hiring in 2019, the pain points that exist for you all on the phone: staff shortages, high turnover, employee burnout, pre-hire screening and initial onboarding, a slow credentialing process, and then compliance burdens and not being able to successfully connect your HR and recruiting processes back with your compliance organization. We'll spend a little bit of time on each of these and then talk about how do we actually get better at overcoming some of these. So on the next slide, staff shortages. The Bureau of Labor Statistics projects the need for an additional 200,000 new RNs each year through 2026 to fill newly created positions and to replace retiring nurses. Healthcare in general is now the largest employer in the United States. Was expected to actually overtake manufacturing in 2022, but actually surpassed those projections and grew even faster in the United States to become the largest employer by the end of 2017, right? So we're now in 2019 where it continues to grow. What a result of that and the demand for healthcare talent has resulted in just a crazy number of open vacancies. There's a talent shortage. It's estimated that by 2022, there's over 1 million vacancies for nursing positions alone. So retiring providers are creating a large gap that cannot be filled fast enough. Just across the healthcare continuum. And then many medical programs, schools, and educators are not keeping pace or unable to provide enough opportunities for more individuals to enter the healthcare workforce in a timely manner. At the rate that we need increased healthcare coverage and delivery to service the patients that need it in this country, we are not filling those positions fast enough. And that's a challenge that you all are faced with every day. Turnover. So once you get talent in your building and in your organization, navigating the challenges that come with high turnover rates in healthcare continues to plague the industry as well. The average turnover rate across the healthcare continuum in 2018 was 19%, right? So 1 in 5 employees are actually turning over on an annual basis. When you look at just nurses, so in a provider organization, the cost of losing a bedside nurse alone is around $52,000, which could result in the average hospital losing somewhere between $4 and $6 million a year. That's what the latest estimates show from 2018 and then 2019 as well. And so why is this happening, right? Younger employees want a more fulfilling experience when it comes to training, career advancement, benefits, and more. And sometimes company culture or job expectations can be misrepresented or poorly communicated upon hire, leaving providers confused and frustrated. Employee burnout, contributing factor to turnover as well. When we look at the actual statistics and what the data shows us, A 2015 Mayo Clinic study found that more than half of American physicians now at least have one sign of burnout, which is up about 9% from the group's prior results about 3 years earlier. We see similar metrics, not just in physician groups, but we see similar metrics across nurses, licensed providers, employees that are non-licensed as well. We're seeing this across the healthcare continuum, which you can imagine is related to there being a talent shortage for the care that needs to be delivered. Healthcare organizations are trying to stretch as much as they can to ask their employees to fill the gaps, sometimes with longer hours, sometimes with increased role responsibility and job demands. And what's happening is we're trying, just like us, every healthcare organization is fighting employee burnout as well as trying to fill seats within their organization. Pre-hire screening and initial onboarding. So there's several aspects to this. On the pre-hire side, is the background check experience a good experience for the candidate? Is it a quick experience? And it also balancing the speed of which it is completed with the thoroughness of which it's conducted as well. Are you doing everything you need to do to make sure that the talent you've worked so hard to source is good to go to be able to work for your organization and in one of your facilities? And at the same time, in being thorough, how quickly can you get that done? To get just what you see on the screen is the pressure to get positions filled, to make sure we're accurately and efficiently and safely delivering healthcare to patients that need it. And then the actual onboarding experience, what does that look like? And we'll talk a lot about this in this session today. How long does onboarding take? How thorough is it? How prepared are your employees to deliver care within your brand and within your organization upon completion of onboarding? Donna, why don't we talk about credentialing a little bit?
Great, thanks. So as the only female voice, you'll know this is Donna. Great to meet all of you and welcome you to our webinar today. My background is definitely in the compliance space. So as we talk about some of the challenges, I'll try to bring the compliance voice to this discussion as well. So when you think about the things that Dave's been sharing and really looking now specifically at credentialing, there's all sorts of challenges, but it's so important, both I'm sure from an HR perspective, operations, clinical, and compliance, that we have the right people in our organizations. So when you look at credentialing and the inefficiencies and the costs, there's all sorts of slowdowns through the process. Certainly we recognize that the verification of that credentialing process can be extremely tedious, and the number of things that we have to look at in a pre-hire component. Costly turnover, right? Every single time a person leaves our organization, this whole credentialing thing has to start all over again. So it's extremely costly. Then from the risk perspective, or perhaps again from like the compliance viewpoint, we would question, is there any uniformity in that credentialing process, or is it left to each of the departments or the facilities, in each individual org? How are you managing that credentialing process? Are we go unnoticed? Because if we take shortcuts, again, that last slide we talked about, that pressure to get those positions filled and get nurses back onto the floor, or nursing assistants, whatever the case may be, right? We need people on the floor to take care of our patients. So sometimes there's shortcuts, and we know that certainly adds great risk to the process. The statistic at the bottom I thought was really interesting. If you think about the cost of slowing down the credentialing process, if it takes an extra 30 days or 1 month delay in the credentialing process, that could cost almost $30,000 in potential lost revenue by not having a physician credentialed in a timely fashion. So you can do the math and see what that would look like across your organization if it delayed the number of credentials. Let's go on and look at, really that question. We have had a series of webinars this year on the relationships between HR and compliance. And we think that is just such an important relationship. But sometimes from the compliance perspective, and I'm sure as you all feel from the HR perspective, is does compliance slow us down, right? Are we holding you up? Are there questions that we're asking or tasks that need to be done that you may feel are slowing it down? So when you look at completing all of those pre-hiring screening tasks before we let someone work their first shift, making sure that they are oriented properly before they're working the first shift. That might seem like an awful lot of, quote, stuff that has to be done, but really, have we taken the time to explain the why behind the importance of completing all of those tasks? So I'm sure we all recognize, right, there are state and federal requirements that are requiring healthcare organizations to look at to do certain kinds of checks. Otherwise, there's significant penalties, so financial implications to our organizations. And then what if we do kind of just cut a corner and we let one of those, quote, bad actors take care of our patients? We know that the potential harm to our patients if we have someone that's working in our organization that isn't properly licensed or credentialed is just infinite liability. We can't even begin to talk about the potential costs and harm that could come to patients if we have bad actors working, caring for our patients. And then really, that onboarding process and making sure that our employees are satisfied during that orientation and that they're really ready to start taking care of our patients and working in our organizations. Ultimately, a satisfied employee, right, means less turnover. So hopefully that saves money for your organization and it increases productivity. Then the last slide we have here is just a slide that, again, we've used multiple times really in our webinars this year, talking about the importance of the collaboration between HR and compliance. And this is just a slide that kind of delineates things that HR typically does, things that compliance typically does, but really shows how important it is to collaborate. And we just wanted to include that today, just as a reminder that compliance really is your partner, and not meant to be a foe or get in your way, but to be a good partner. So let's go to our first polling question, Matt.
Great, thanks, Donna. So we have a series of polls, I think about 4 or 5 today, and we're just interested in your all's feedback and would love to just kind of see where you guys stand. So our first question is the biggest contributor at your organization. And we'll leave this open for about 10 seconds or 10, 15 seconds to let some people fill in here, and then we'll discuss.
And I believe there is an other option as well. If there's something that your biggest contributor to the challenge that you have in your recruitment process is actually other, would love if you just in the questions tab of your GoToWebinar panel, just tell us. We'd love to know and get some insight into what you all are facing. That helps us. Here's a little bit about what we do with this content on the marketing team is we kind of take this and then use what you all really care about to build new content, new resources and things that we can send back as, hey, here's a quick checklist that might help and that sort of thing. So if there's something that you really care about, let us know.
Great, so we'll close this out and I'll share the results.
Awesome. So what's the biggest contributor to a difficult recruitment process? Overwhelmingly is a lack of candidates, and there's no surprise there. About 63% of you said just a lack of candidates and a lack of choice in the talent pool. 5%, interestingly enough, said poor internal communication, right? Which, curious to hear more about that, and we'll get into some of that today. 16% is no brand awareness, so no one knows your organization. And then 16% is other. So again, if you picked other, would love to just hear a little bit more from you about what that actually means for you. Interestingly, that 0% said lack of technology as well. So recruiting in healthcare may not be a technological challenge, or that may not be the most dominant, but some of the other ones are more prevalent. So thank you.
Our next section, this is Mike Rosen, by the way, is Smarter Healthcare. And as Matt mentioned, we have rebranded, and both our services and products and the way we approach healthcare compliance really does have everything to do that we believe smarter healthcare makes safer healthcare. And you play an important role in that, a very integral role, bringing, recruiting, finding, and keeping the talent that it takes for healthcare to even occur. Let alone for it to be safe. And so we're going to jump into another poll question here to delve a little bit more into the mindset of the people and for you to see what others may be experiencing. Matt, you'll launch this poll question.
Sure. So our question here is, which part of your current recruitment process gets in the way of effective or timely hiring? And a few of the options here, credentialing, talent sourcing, onboarding, lack of departmental collaboration, and pre-hire screening. So we really wanted to make sure that we included these options. Unfortunately, we can only offer 5 options. So again, if it's neither of these, or if it's none of the answers offered here, please just chime in there and let us know what that may be for you.
So we'll leave it open another second or two and let you all continue to fill in. Thank you all for your participation. And again, this is the, there may be several, and maybe multiple answers, so pick the one that's the most prevalent in your organization. We will go ahead and close it out, and then we'll show you the results on the screen. So again, which part of your current recruitment process gets in the way of effective or timely hiring? About 23% of you said credentialing, 23% said talent sourcing, and then 23% said onboarding as well. Interestingly enough, that it's a 3-way tie between those. But the leader is actually pre-hire screening. Interestingly enough, almost a third of the people on the phone said pre-hire screening, and 0% said lack of departmental collaboration as the primary indicator or the primary delay in recruitment process. Thanks again, Mike. Take it away.
Yeah, so that's very interesting. You know, my guess would be if we had said all the above, you probably 100% of you would have said that. We recognize that there's a colossal set of forces here coming your way, and these are things that you're going to have to tackle and try to improve. And we want to give you some education and or some ideas to go back and try to do so in most of these areas, actually. With regard to the pre-employment screening, that's actually the area that I spent about 15 years in before starting this company. I know what it takes for, and it's very complex. There's various state laws that can apply specific to your vertical within the industry, like post-acute versus acute care, the types of statutes you have to apply to comply with, the notices and things we're going to talk about down the road that must be done correctly in order to avoid lawsuits. Just know that the plaintiffs bar, the lawyers that file lawsuits, are all over this. And we have conducted a very lengthy deep dive into a prior webinar on pre-employment screening, the difference between pre-employment screening and ongoing monitoring. And maybe we can produce a link to that, Matt, in what goes out, because I think you find some, for those of you who talked about pre-employment screening pains there, some really helpful information. That's not going away, and the EEOC and plaintiffs' lawyers are all over it. So unfortunately, it's something that you're going to have to live with. But for purposes of today, the most important thing is that obviously you pick and select qualified individuals, which includes that they're properly licensed, that they're not excluded, and many other facets. And then that doesn't end upon the hiring. You have to monitor those things. So the freedom from process is probably one of the things that is bogging you down, and one of the things that technology can help you with. I was really glad to see that not many of you thought technology was a contributor. That means you're using some form of it, a third party or your own process to make that better. But these administrative tasks, they can actually be automated. They cannot be circumvented. I think if you go into the approach of, I just can skip some steps and hope I get lucky and not audited, or the majority of the time people are who they say they are, so we don't really need to go verify that. It's really not a good compliant way to approach this, and it sets the wrong tone for the culture of your company. And so keep in mind that where others can help you, that's obviously one area technology can do so. When it comes to the fact of recruiting and doing it in a precise way, there is data, and there are data-driven approaches that you can utilize. And we're not here to recommend any one software or to pitch anything or even sell you, but just to open your eyes to the fact that there are technological data-driven metrics that you can use to look at the volume of applicants. For those of you who said, I can't even get applicants to find us because our brand isn't out there, you have a whole nother area that you have to sort of backtrack and find out why that is the case. Is it that it's a very competitive market? Is it that there are the brand is new to the area? People don't know yet who you are, and we'll talk about some creative ways to get that done. But it could also be that there's just other employers that pay a little bit more that are going to detract from that. And so for those of you who are dealing with that, that's a tough one to have to step back, but an important one. For those of you who have the benefit of a lot of people applying, that also can be a burden, because you have to, that sounds great to those of you who can't find people, but for those of you who are inundated and constantly getting barraged with candidates, you have to go through the process to find the right ones. Studying really the average length of time it takes to fill the position is, I think, a very good metric. It really will provide you insight as to how efficient you are and where you might get better. So if you aren't today and can track from the date of which somebody responds to an ad or some type of recruiting effort to the point in which they're actually on the floor and billing, is a very measurable and very relevant piece that you could always improve and make that one of your goals for your department. Finding and being nimble to finding the right candidate, that is such a loaded area. I mean, this has everything to do with the messaging. It has to do with the brand that either is ahead or behind you, has to do with the market that you're in. But it is so critical, because I know that a lot of times HR is forced to put a warm body in a position because it's empty and it's needed. But that person, if you can, should be the right fit and be the right culture fit, so that you can continue to do the things that as an HR professional you're trying to build within the organization. Some of the ideas and some of the things that we've seen, we actually have a client of ours, Deaconess Hospital in Evansville, Indiana. We love that they were in the news recently. They're actually quoted in Becker's Hospital Review of how they opened up and partnered with a local community college to provide on-site on-site training and the ability to get your hours that are necessary to complete the program. Now, where is that candidate likely going to go when they graduate from the nursing program? And it's going to be Deaconess. And that's a competitive market. There are multiple hospitals, multiple large brands throughout the Indiana and Midwest market that are within 3 blocks of that Deaconess Hospital. So it's very important that when you can, you partner with local schools or certification programs so that the people are more likely to choose you when they're done. And those include everything from internship, referral programs. We have a program here at our company where we actually will pay a $1,000 signing bonus, referral bonus, for somebody that brings in a candidate that stays for more than 90 days and is the right fit. And we've probably gotten 5 or 6 people that way. And it's the best and most happy check we can write to somebody, because they're willing to say, I like it so much here, I'm going to refer somebody of my caliber. I want them to be a part of this, of what's going on here. And that's the kind of right person you're looking for. And they're probably willing to do it without being paid, but they're certainly going to do it if there's a paid referral program. And then, of course, tuition reimbursement and debt payoff. This, I can't tell you how many times I've seen people. We actually had one of our employees' girlfriends. They were here in Nashville. They actually moved to California because she was able to get a job as a nurse practitioner, having just graduated from Vanderbilt. She had no problems getting offers. Vanderbilt's a very notable program. She actually took one at a Planned Parenthood in Palm Springs, California, not because it was in Palm Springs and not because I think she was passionate or dispassionate about Planned Parenthood, but as a part of her income package, they paid off her debt if she stayed for 2 years. And that's a really nice benefit for people. And so these are the kinds of creative things that we see out there that you might be able to include. When it comes also to recruiting, having unique and relevant job content, what does your job description look like? Is it boring? Does it sound like I wouldn't even apply for that job? Or is it some way that you can create and show your personality and the importance of, let me give you an example. We have an HR function at our company, and Jody Murphy, who heads that up, is in charge of people operations, and we call her our dream weaver. Her job is more than to make sure that we are staying compliant with HR and recruiting and all those things, but helping people career path. And so she's known around here as the dream leader, dream weaver. And it's doing a function that she was already going to do, but in making it a way that is more relevant and more, I guess in some cases, millennial. But what does your website say about that? If I went to your website, is it look like every other hospital in the area, or is it showing that there's more than passion and compassion and care here, that you really care about people? Are you doing things in the local community and putting that on your website? Do you do the American Cancer Walk or the MS Walk, or what are you doing to show that you care about your community? That matters, and especially to the millennials these days. And job titles. So come up with the titles that are not just a nurse. It's a caregiver of with concern in long-term care or something of that nature. These are things that I think can make you different in the marketplace. And then measuring that, this helps you build your brand. It's a total asset when it's done right, but it has to be also coordinated with your marketing team on social media. I can't tell you how important that is, obviously, in today's markets. So the predictive analytics that we're really talking about here will enhance that whole job board experience, where you're found, how you're found, and getting people to come to your site as opposed to your competitors. And speaking of, look at your competitors. What are they doing? What are they posting, and why do you think people are maybe taking that? Well, it may be based on the way that they approach the market, or the way they take the exact same job you have but make it sound more appealing. So you can always learn from your competitors. So culture, it's all about reputation and culture. You and your brand will be the best asset in attracting the right people. Is your organization the top of mind in the news for the right reasons? So if you've recently been in the local nightly news, or God forbid the national news, for opioid overprescribing or for overbilling or for some False Claims Act, that's not helping matters, right? And these things happen, and it doesn't necessarily always mean that it was in fact a false claim. But when you're out there looking for a job, you're going to look and see, what is the reputation of the hospital? There's 5 hospitals within one concentric mile of where we're sitting in Nashville, Tennessee, each by different competitors. Why would you go to one versus the other? And so, people who want to work there are looking at the things that we've already talked about in that regard. So any type of reputation that you can get for being innovative, creating new products, doing things that are different, that really helps expedite this. And then as we wrap up the reputation and culture, there's both a workplace culture, right? Do you want to work in an environment that's diverse and is like you and the people that you live with and are in your community? That's important. The answer should be yes. And so having a diverse workforce and showing that there's nothing to be ashamed of. That's exactly what should be the culture you're building there. What awards have you won? Best places to work? What types of things can you put out there that people look for? And then, of course, on the quality side, because remember, a smarter healthcare is a safer healthcare. On the quality side, if you're in the long-term care, what's your star rating? People look at this stuff. They want to know. There's pending legislation that may make you forced to post what it costs to do certain procedures in your hospital. It is becoming more transparent. Use that to your advantage to highlight the things that are going well at your location. So a couple of fun little statistics there. 75% of job seekers will look at the brand. This is not just us saying it. This is based on research. And 1.2 million staffing gap of nurses by 2020 is only going to exacerbate that problem. Dave, why don't you talk about on the branding side, since you are a marketeer, how you can share these best practices?
Yeah, absolutely. Thanks, Mike. So we've got a couple of hard numbers for you that'll help put into context a little bit about what Mike shared, and a little bit of some suggestions and even some of the things that we do at Provider Trust to help combat this. So the first number you'll see there is 75%. So 75% of candidates research a firm's employer brand and reputation before applying for a job. They will go on your website, they'll do their due diligence. We actually see this all the time. I am on the marketing team at Provider Trust. The marketing team and our HR and recruiting teams actually partner to share analytics on our digital properties to understand job seeker behavior. And what job seekers actually do is they hit your website, ours, using us as an example, they hit our website and they start searching around and they end up browsing anywhere between 8 to about 15 pages before actually applying for a job. They do not just go, contrary to I think what most of us had assumed previously, job seekers do not just go to our providertrust.com/jobs. They hit our homepage, they start searching around, they get a flavor for who we are and the types of solutions we have, and they hit multiple pages and do their research before actually applying for a job. It's critical then that your digital experience is enhancing job seeker behavior to understand how does it complement getting the right talent through your door. 83%. So 83% of employers say that their brand plays a significant role in their firm's ability to hire talent. So the employers surveyed by the two companies you see at the bottom left actually said that they use their brand marketing and their employer brand as an asset. We do that as well. So providertrust.com, you'll see all over our website the culture awards that we've won. We've invested in building video content that speaks to the type of workplace that we are, the diversity that we have within our organization, beyond just the technology solutions that we solve in the marketplace, as a way to promote getting the right talent in the building. And then 69% of candidates would not accept a job in a firm with a bad reputation, even if they didn't have a current job, right? So think about that. A job seeker that might be desperate for their next paycheck and to join an organization would actually not accept an offer after doing research and finding out that your employer brand wasn't up to snuff. There are a ton of ways in which you can take this back to your organization to partner and get smarter about recruiting. The first one that we would suggest and we would offer is partnering with your marketing team to understand digital analytics and job seeker behavior. What is the content assets you are sending out to the marketplace that promote your brand, promote your workplace, promote your diversity, and promote career development, and what it's like for the average individual to join your organization, use that opportunity as a springboard to advance their career and their personal lives as well. That's something that we believe in wholeheartedly. There's also subtler things that you can do. So we like to highlight our culture all the time. We just, Matt mentioned before, we did relaunch our website just a week or so ago. As part of that, we wanted to highlight the people that work at Provider Trust. So even just something silly and fun, like putting professional headshots and then having the ability, if you go on our website, to actually highlight a little bit of what these individuals are like on a personal level, goes a really long way. You all would not believe how many people have noticed these that are either clients or even prospects of ours or even just partners of our brand have reached out just about our actual employee headshots more so than anything else on the website, right? It's the thing that resonates with people and specifically job seekers. I'm not suggesting you have to go do this on your corporate website, and large healthcare organizations may not have this flexibility, but how do you actually show the personality of your people in the things that are enhancing the job seeker's experience would be something I would recommend. So with that, talking about a consistent candidate experience. So what is that process like once that person hits apply on your website for the job? Is it consistent, and how are you enhancing and measuring that over time? So as an example of questions we would suggest asking yourself, are your recruiting practices repeatable? Are you reinventing the wheel every time somebody applies for a job? Or do you have a scalable, predictable way to evaluate talent and deliver a delightful experience? Does everyone interview following a tried and true process? What is your consistent baseline measurement ability on assessing talent? Does your message match your marketing materials and your website? This is critical. However people hear about your brand, understanding brand consistency and what does that mean to enhance the job seeker's experience is critical as the data would show. Are you confident your organization's best image is consistently shared with all candidates? Even just small things like meta descriptions on a website or featured images on certain web pages, so that when you share a job posting on LinkedIn, there's a delightful picture that shows. Those small things add up to create a delightful candidate experience that could be a game changer for your organization. Do you outsource any of your interview processes? What does that look like? Are you using an external partner? Do you utilize testing of any form to ensure cultural fit or ensure a skill match? Are you asking the right questions? And then if someone left and came back with their candidate experience look different for the better? I love this question as somebody who has done at one point in my career a boomerang and left an organization and came back to that same organization, thinking about what that candidate experience was like. It's a good question to ask ourselves is how is that changing over time? And so again, some hard numbers that are going to put this into perspective for you. So we had 3 last time, there's 4 this time. 95% of candidates are more likely to apply again if they have a positive candidate experience. This was a real eye-opener for us when we were starting to look at this data, because if a candidate doesn't actually get a job, that doesn't mean that they just leave your pipeline forever of talent. There may be a job that they are better suited for down the road. And so if you give a positive candidate experience, but you reject them politely, as an example, they may actually come back around and apply for a role that they're best suited for. And that's a crazy statistic of 95%. 97% of candidates who had a positive experience would refer others to apply. And so again, this is Mike spoke to this earlier of having a candidate referral program, what that looks like. And the reality is having an effective candidate referral program actually comes back to your candidate experience when that person is hired for the first time. It's the person who's on board and has a consistent experience that then takes that experience and refers the experience itself to their friends and family. 88% of candidates who had a positive experience would increase their purchase with the company, right? So again, depending on vertical and who we are in the industry and being who we are in healthcare, this may or may not apply. For us, it does. So we've had people that work for our clients or our partners in healthcare apply for jobs with us. Sometimes it's been the right fit and they've joined the team. Sometimes there just hasn't been that right opportunity to facilitate the right growth and development for the individual. But in that case, we've seen this happen where we maintain the relationship, maintain our brand standards and brand image, and they're a better client partner, even though they didn't join the team. Critical to make sure we're assessing that. And then 55% of candidates who had a positive experience are more likely to tell their social networks about that positive experience, right? Not just the job. We're talking about the experience of being a candidate, and that's what they're likely to share on social media. Critical to understand and to leverage these in your analytics.
I think in the interest of time, we can refer you both to the prior webinar that we'll link you to this afternoon and have referenced earlier, but you really need to follow certain very prescribed methods to stay compliant on the HR background check side, and that includes the Fair Credit Reporting Act, having a release, and things of that nature. If there are any questions in that regard, happy to address those separately, but I think in the interest of time, we can move to a different section.
Cool. So we have one poll question that we'll run. I think this is the last one, Matt. So our last poll question before we get into predictive data and monitoring is, what kind of recruitment metrics do you monitor? So the choices here, and again, there may be several of these that you are monitoring. I would ask you, if there are several, just to pick the 1 or 2 that you pay most close attention to. So of all of these, which are the metrics that you're paying the most close attention to and you're making actionable decisions off of? So the first one is average length of time from job posting to hire. The second one is average length of time from job offer to first day worked. The third one is average length of time to complete internal pre-employment screens. to getting somebody on the floor. And then the fourth one is average length of time to make final decision from final candidate interviews. So we'll leave this open just for another second or two. Again, would love to hear if there's a fifth option. So in the questions tab, go ahead and submit if there's anything else that you'd like us to know. Just another second or two. Okay, Matt, go ahead and close it out. And we will share the results. So kind of all over the board, we've got 60% of you say the most important metric is average length of time from job posting to hire. About 20% is average length of time from job offer to first day worked. 10% is average length of time to complete internal pre-employment screen. And then 10% is average length of time to make final decision on hire. Awesome, great insight. So predictive data and monitoring. Again, we'll breeze some of this pretty quickly, just in the interest of time, but predicting the right hire is where we'll start. So what does that mean? How do you get predictive about hiring? And I think this is the combination, our point of view is it's a combination of looking backwards in a candidate's experience and prior history. That's everything from work history to how did they perform in an interview to their ongoing sort of credential results, right? Has there ever been a license revocation or a sanction that is important to know for future care? And then looking forward is understanding where are they at now, and based on all of the summary of their past, how are they going to perform in the given role? So finding the right fit, and we'll go through different sections of this. The first piece of this is the actual interview process itself. So are you assessing talent with an internal interview information? Are you using third-party talent evaluation? And are you measuring against your company's core values? What is the process to actually, from the interview itself, actually get a sense of how effective is this individual going to be once they get on the floor and through your door? The section on here, are you measuring against your company's core values? We at Provider Trust assess for this deliberately, in which we search for talent that meets certain parameters that we have deemed as crucial to success in our organization. Some of those are your competency and relationship extension, your integrity, your positivity, your conflict and your ability to resolve conflict, and what does that look like? For us, I'll center on positivity just for a second. We try to hire for positivity, knowing that in a culture like ours, when we're trying to solve different and disparate client problems, when things get really tough and there's an interesting problem to solve for a client, we have the mindset that a positive attitude wins the day and is the best fit, not only for us, but for our client organizations. So we hire for that specifically. For performance, we also look at analytical profiles that help predict performance success in a given job. So based on, again, if we're hiring, as an example, if we're hiring an RN position, we look at prior job history and understanding of any metrics that we can find, and then we look at, okay, what are the key pillars of success of this job, and how does this person perform in a job in which we benchmark numerically. We try to assess that on an interview. We also try to assess that during onboarding, and we try to assess it in the first 90 days to make sure we're truly understanding statistically how effective is that person going to be. And the last two here with just talent assessments, online behavioral assessments. We do this for for most of our employees here at Provider Trust. There's a number of different ways, but we try to understand just in behavioral scenarios, how will someone respond? And we do so in an interview format. We do so with digital formats to get a better sense of, in a real world scenario, how will this person interpret the challenge and how will they attempt to solve the challenge? And then behavioral interviews, right? So not just the online piece, but again, what I was just saying, as part of our interview process, we give scenario-based prompts that help candidates try to put themselves in the challenges of the day-to-day and understand and better predict how they'll perform.
Okay, the point we wanted to stress on this screen here is that there are certain qualification questions that you need to have and know the answer to remain, certified that you're doing the things you need. And if there are any gaps, really, are what you're looking for. But don't forget to check former names. The OIG's made that very clear for OIG exclusion screening, that you need to search the names that certainly if they provided them to you. It's no defense to say we didn't know that she was previously a Smith, now she's a Johnson, or whatever the case may be. And then knowing their license history, have they had one in another state? Because for those people who do travel from state to state and are mobile with reason to be, although the minority, they're doing it because they've run from some previous action. And so I think Donna can show you an example of that we uncovered for a client recently.
Excellent. So yeah, so this slide is a real example of, like Mike said, one of our clients' experiences prior, of course, to them joining our client. So the story starts in 2016 with an allegation of theft from a patient. So at that point in time, the healthcare organization does what they're supposed to do, does their investigation, presumably terminates the person and reports them to the licensing board. As we all know, investigations by the licensing boards take a significant amount of time. And in this situation, the records show that it took a year for the board to take action against the person. So they initially, as you know, issue the information. The license holder has the opportunity to defend themselves, and in this particular situation chose not to do that. And so a month later, then the board revoked that person's license. Now, fast forward another 6 months or 7 months, depending on how you count, I guess, from July to January of 2018, the OIG then decides to exclude the person. And we're going to talk about this in the next slide, but this time frame is very familiar to us. We track the amount of time it takes for state actions to get up to a federal level. So on average, it does fall into about a 6-month time frame. And remember, the important thing to remember here is the OIG has the permissive authority to exclude someone based on a license revocation. But in this case, the seriousness of the action evidently was such that the OIG felt a need to exclude this person related to their license revocation at the state. We know that SAM.gov basically does whatever the OIG does, so they excluded the person at the exact same time. So now look at this story. In this time frame from somewhere from 2016 to May of 2018, this particular practitioner moved states and changed their name. So when our client hired them, they did pre-screen them, they did some background checks, but they didn't check any former names. And this person, because they changed their name, passed all of the pre-hire employment screening. Once they came into the provider trust organization, we have the ability with our augmented data to find matches based on social security number and name and address and a variety of data elements. But because of the data, we were able to find that immediately upon the data coming into our system. So it's really important, like Mike said, to make sure that we're looking at former names, different states, because our workforce is extremely mobile. The next slide, Matt, we want to just quickly cover what we kind of see in our organization as we're looking at license management, if you will. So this was just an example of an onboarding of an organization that had about 8,000 active licensed practitioners, and you'll see that we had over 1,000 issues. 13% of their staff, we were unable to either verify the license, we had to use a different name that we found, it didn't match the name that the client gave us, or at the end of the day, 16% of those licenses were actually expired. So when you think about the processes that you have in your organization, I think you can realize how difficult it can be to really know that you have the right person with the right license. And then the last slide in this section that we want to cover off is just some lessons that we've learned from our clients and from our data. And kind of as those last two graphics have shown, 1 in 8 employees don't have the proper license or certificate that your organization says that they have to have. So when we onboard our clients, they tell us for this position, this person or this role has to have a license or a certificate. We go out, we verify that, and we find that 1 in 8 doesn't have what you all think that they were supposed to have. We also know that most organizations are really only looking at licensures upon the renewal process. So maybe that's every 2 years. So if you think of that transient or mobile population and the things that can happen in a short period of time, if you're only looking at licenses upon renewal, you might be missing a fair amount of information. And as I said, 43% of all of the OIG exclusions relate to licensure action. So your verification and process pre-hire of licenses is really important. And again, as we said on that last slide, it takes about 6 months or 173 days for an action at a state level to get to the OIG. So time really does matter. So let's just wrap this up, Dave, in kind of the next steps in action planning.
Yep. So in the last minute or two, next steps from here. So again, you'll get all of this data and all of the slides to take away, but here is where we'd start. The first is to identify your gaps and do a gap analysis. So where can we improve? What are the metrics that we think are most mission critical to getting the right talent within your organization? And where can you move the needle the most? And where does it make sense to start? Understanding the pain points and the expectations for each potential hire, we would recommend actually going back and interviewing some of the people you've recently hired to get a sense of what their candidate experience was like, and how much or how little they researched your brand before they took the job. Also understand your strengths. We talk a lot about understanding your gaps and what can you improve and how to get better. Understand the things that your brand does really, really well too, to make sure that those aren't ignored or lost in the process. That's critical as well, in making sure you know not just your gaps, but also what you're really good at. The next thing is understanding your gaps to optimize your recruitment process. So keep a pulse on brand and social engagement, both online and in the community, and you're understanding your brand relevancy. We would suggest create an individual and memorable experience for every potential employee or job seeker, both in a digital environment and in a physical environment when they actually come into your building or office. And then optimize your strategies accordingly with precision recruiting, understanding how to enhance the online job seeker experience as well as the physical in-person element of it as well. Third, pretty simple, measure the progress. So what are the goals you want to set around it? How are we going to improve? What are the benchmarks, and what are the industry benchmarks that we want to surpass or achieve or be on par with? And using analytics to make informed decisions. People data is critical to understanding how to get the right talent, how to retain the right talent, and how to empower, coach, and develop the right talent as well. Understand that you're measuring people data throughout all processes and all aspects of your organization in your HR function. The next slide just says ensure holistic monitoring. So this is critical. This is a little teaser of the next step. This is going to be our next webinar next month, but this is a little sort of preview, is to say you've worked so hard to get the right talent within your building. How are you monitoring that talent to make sure you're retaining it, verifying the credentials are up to date and accurate, and they have everything they need to deliver the quality of care by which you staked your brand reputation on? It's critical to connect those two, and we'll provide some insights and best practices on how to do that. And then finally is take on the next challenge and make this a rally cry for your HR function to understand what to do next and what makes the most sense. And lastly, it is 12:58, so we do have a couple questions come in. Just for the sake of time, we are firmly committed to starting and ending on time. So we'll end today and end this session. You will get the recording. You will get the slides after the session. For those of you that submitted questions, we just went a little too long today. So we will reach out on an individual basis and make sure we get everything answered.
Great, thanks, Dave. And I want to say thanks to you guys again for spending this time with us, and please be on the lookout for your email with your recording and your copy of the slides this afternoon. Please share and spread with whoever you think might find it valuable. In this slide, presentation that we share, all the links that you've seen so far are clickable. So please navigate to whatever you're interested in, and give a look around on our website. We did just redo our resource library. We now offer around 400 free resources for you. That's all filterable by whatever topic is relevant to you at this time. So all these are clickable, and we're happy to share this with you. Again, please respond to that email if you have any questions or concerns for me, and I'll get back to you quickly. So with that, thanks again for being with us. Mike, Donna, Dave, thanks for being here. And I hope you guys have a great rest of the day. And please sign up for the rest of our series over the next couple months. Talk to you soon.